Hi there, my name is Colleen Arrington. I am participating in the caregiving consultation program, and I am the only child of Carol and Bud, and my parents are both currently experiencing some difficulties with memory. My mom has been diagnosed with dementia. It's a relatively recent diagnosis. But has progressed from mild cognitive impairment to dementia, and is definitely a big change from her prior functioning. My dad has also some memory issues, has not specifically been diagnosed with dementia, but has had long-term health issues, diabetes, and I think from the minimal medical input that I've gotten, but also observation and experience with him, is he's definitely taken it's taken a toll on his thinking and memory and cognitive functioning, and that's come from more his endocrinologist and nurse there, and we have yet to have evaluation from a neurologist. I don't know whether he'll participate in that, my dad, or whether we will just move forward with support as needed for both of them together. So I became involved in the care consultation program on a referral from a friend. I think she had posted some about MemoryLane, and I said, hey, kind of going through some things with my mom and dad, and can you tell me about what services you're involved in? And so she said, let me put you in touch with Lindy. We have this consultation program, and I think you might really like it. So I talked with her, and she did a great job explaining it and kind of letting me know what supports were available and what the program was like. I'm a therapist and social worker myself, and I know that sometimes we're the worst at probably asking for help and getting involved in something like that. But I also knew that support and self-care and help and support for me as I help my mom and dad is so necessary and important. So I said, absolutely, for sure, I'd love to be involved, and started meeting with Lindy for some of the coaching calls. My caregiving situation with my mom and dad is, I don't live with them. They lived independently prior. And then throughout the past 6 months, we started the process of getting them into a senior living situation. So I went from starting to go to doctor appointments more, starting to pursue a neurology evaluation, to really consistent daily phone calls to help manage my dad's diabetes, blood sugar tests as well, and then also my mom's progression through the neurology evaluation process and getting started with some of her doctors and at least the diagnosis for dementia. So now I currently am their driver to their doctor appointments, and really we're at the level where I need to be there present for doctor appointments, or things do not get addressed or remembered or communicated accurately. So I don't have a direct care as far as taking care of them on a day-to-day basis with daily living. They actually are pretty independent with that and are currently living in a Swan Creek senior living apartment, and take care of a lot of their health and the daily needs. But I'm more of sort of overseeing and communicating and managing a lot of that. As I said, I'm an only child, so it is just me. And so I guess that kind of leads me to how the care consultation program has helped me. It really has just provided that emotional support and that understanding ear of, yes, I get it. And yes, that must be hard. And I would say that's been so useful to me, because I do feel like when I talk to Lindy, and I have attended some of the support groups, I had the same reaction then, like meeting other people that really did get it. It just brought tears to my eyes, and it just felt so useful. I don't always have time to get to the group meetings that they have, but it was so beneficial to be there and to hear, yes, other people really do get what this experience can be like. So I would say it is so valuable and helpful to participate in. I just wish I could do them more, but I do them when I can make it work. The calls with Lindy, I think, have been really useful and in helping me to take that next step. Sometimes there's things that I'm thinking about or like, yeah, I probably should look into that, but helping me to say, yeah, like it's okay to take the next step. I just felt like one thing in particular, and this is silly. I mean, I know asking for help, I know reaching out, I know letting people know what's going on helps, of course. But I think regarding my mom and dad, I hadn't reached out and let I'm an only child, but she comes from a family of 10, and all of my aunts and uncles and cousins didn't really know what was going on. A couple of them, maybe a little bit. But after a call with Lindy and where we talked about who could you help bring in and be informed and be helpful, I just did a quick text to like key aunts and uncles and cousins that I knew would help spread the word. And it felt like such a relief to have everybody know and to just hear encouraging words back from everybody. And it really helped me to have Lindy just say, yeah, bring those people in, bring in family and other people that can even just check in with your mom and dad or can visit them occasionally or help out. And that was so useful for me. She also referred me to the person that helped get us into the senior living. And so that was such a valuable resource to get connected with sort of a senior living finding person. So that was such a helpful process to go through as well. They really help my parents adjust to the process of looking for senior living and knowing it was a positive thing, not a negative thing like we're putting you away somewhere, but more of these are the kinds of things they can help you with. These are the kinds of things that can be useful to you and beneficial to move to this, and just a person that they could really relate to as they started to learn about that process. So that helped tremendously to get involved with, and that was the Care Patrol program that we got involved into. So as far as how the care consultation program has helped my loved one, I would say it's been indirectly, because I have been a better caregiver and a better daughter, I think, to my mom and dad because of being involved in the care consultation program. They don't even know much about it. I mean, I've referred to it before, but I didn't feel like it was necessarily at that point for what I'm involved with important for them to know exactly what it was. So it's just helped me to be a better caregiver, I think, and support and daughter to them, and helped me to maybe feel a bit less stressed, a bit less angry, maybe a bit less scared with the whole process, kind of knowing I have someone to talk to and go to about those things, and just someone that's going to reach out and check in. I don't feel like it's ever pressuring or inconvenient. Sometimes I've had to cancel, and I feel horrible about that because I know people have it in their schedule, but with working full time and managing my 2 teenagers and everything, I sometimes have had to say, I cannot meet today. And I've never felt that that's been an inconvenience or something that was looked down upon. I really have felt supported and just follow up next time when we need to. And so that's been super useful as well. And not at all feeling like another pressure in my life, because there's a lot of things that have felt like that. So I really am grateful for our involvement with the care consultation program. I hope that I can continue to benefit from that resource, and would definitely refer and encourage other people to get involved as well. So please feel free to reach out to me, share my information. If there's ever anybody that would have questions about it or want to know more about it, I would be absolutely happy to share my experience or answer any questions for everyone. Thanks a lot.